In the world of healthcare, trust is the bedrock of the patient-doctor relationship. Patients share their most vulnerable information, their deepest fears, their most intimate health details. They expect that this information will be guarded with the utmost care. This is not just professional courtesy, it is a fundamental right. The conversation between a patient and their provider is sacred. It is built on confidentiality. Honesty is essential for accurate diagnosis and effective treatment. In our digital age, communication has changed, but privacy must remain absolute. This sacred trust is now tested in complex ways. The phone call has evolved. We live where voice travels over the internet, data is stored in the cloud, and information is more accessible than ever. For providers, this brings significant challenges. How do you embrace efficiency while upholding patient confidentiality? The answer lies in understanding the risks and responsibilities of these tools. It requires a commitment not just to healing, but to protecting sensitive data. Most of us have encountered HIPAA, the Health Insurance Portability and Accountability Act of 1996. We see it on forms we sign, often without a second thought. But HIPAA is far more than paperwork. It is a federal law protecting patient information from disclosure without consent or knowledge. It sets national standards for the privacy and security of PHI. PHI includes your name, social security number, medical history, diagnoses, and treatment plans. HIPAA is the legal backbone of patient privacy in the United States. For healthcare organizations, compliance is not optional. It is mandated by law. The law applies to covered entities, hospitals, clinics, health plans, and clearinghouses, and to their business associates. That includes billing companies, data storage services, and communications providers. HIPAA's core, the privacy rule, governs use and disclosure of PHI, and the security rule requires safeguards for electronic PHI. Voice over Internet Protocol, or VoIP, converts your voice into a digital signal. You can call from a computer, a dedicated VoIP phone, or a traditional phone with an adapter. Instead of copper lines, VoIP sends calls over the internet. Healthcare adopted VoIP for affordability, multi-location flexibility, and powerful features: video conferencing, secure messaging, call forwarding to mobile devices, and detailed call logging. A doctor can conduct a telehealth visit hundreds of miles away. A nurse can receive an urgent, secure text from a specialist. Automated reminders reduce no-shows and improve efficiency. Staff can manage calls from anywhere. VoIP makes healthcare more flexible and responsive across the organization. However, convenience brings significant risks if not managed properly. Standard off-the-shelf VoIP isn't engineered for healthcare's security demands. Without specific protections, transmissions can be intercepted. Consider a call discussing a cancer diagnosis, or a voicemail detailing a mental health treatment plan, or a fax with an entire medical record. The very features that help can also create vulnerabilities. This is the double-edged sword of VoIP in a clinical setting. On one side, modernization and better patient care. On the other, potential gateways to devastating breaches that violate the law. The difference is the security built into the system. A standard VoIP prioritizes convenience and cost. A healthcare-grade VoIP prioritizes security and compliance. Understanding this distinction is the first step toward using VoIP safely and responsibly. In healthcare, communications must meet clinical needs and legal requirements, without compromise. A VoIP system cannot simply declare itself HIPAA-compliant. Compliance is not a toggle, it is a comprehensive framework of security protocols, administrative policies, and legal agreements. First and foremost, a business associate agreement, or BAA, a binding contract between the covered entity and the VoIP provider, the business associate. The provider acknowledges HIPAA responsibilities and pledges safeguards for PHI passing through its systems. Without a signed BAA, the service is not HIPAA compliant. Period. Beyond the BAA, technology must meet the HIPAA security rule. Top priority, end-to-end encryption. From call start to end, the data must be unreadable to interceptors. This applies to voice, voicemails, faxes, and messages. Encrypt data in transit. Encrypt data at rest, including recordings and call logs. Implement access controls, unique IDs, strong passwords, multi-factor authentication, and role-based permissions. Front desk may see call schedules, but not a physician's confidential voicemails. Maintain detailed, immutable audit logs of who accessed what and when. Physical security matters. Data centers must be protected against unauthorized entry, fire, and environmental threats. Resilience is required by design. Protect the network with firewalls, intrusion detection, and anti-malware controls. True HIPAA readiness is multi-layered: legal agreements, advanced encryption, strict access controls, and physical safeguards. A comprehensive strategy protects patient data from every angle, keeping communications confidential and secure. Compliance is the mechanism by which ethical duty becomes enforceable, auditable practice. Using a non-compliant VoIP system is like leaving the medical records room wide open. The risks are profound and multifaceted. The most immediate danger is exposure of PHI. A hacker could intercept a sensitive clinical discussion. The result can be identity theft, fraud, or public blackmail. Legal and financial consequences are staggering. OCR penalties can be severe. Practices have been fined for inadequate risk analysis and missing BAAs. Fines escalate by negligence level, millions for willful neglect. Penalties can threaten viability. Breach response, notifications, media, mailings, call centers, credit monitoring, forensics, drives costs sky high. The most damaging consequence: erosion of patient trust. Rebuilding reputation is a long, uncertain road. Selecting a VoIP provider is a critical decision. First question: will you sign a business associate agreement? If the answer is no, or they hesitate, the conversation is over. Legitimate providers have a standard BAA and can discuss obligations clearly. Verify technical safeguards: end-to-end encryption for voice, video, fax, and messaging, encryption in transit and at rest. Confirm MFA, role-based permissions, and detailed immutable audit logs. Ask for healthcare case studies and testimonials. Check for third-party certifications. Not a HIPAA substitute, but proof of security rigor. Review data retention policies and breach notification timelines in the BAA. A HIPAA-compliant VoIP system is a secure communications hub that strengthens patient care. It builds patient trust, supports ethical care, and protects against crippling fines, lawsuits, and reputational loss.